Will President Trump implement restrictions on gender-affirming care? Donald Trump has made the restriction of gender-affirming care a key part of his platform for the 2024 presidential campaign. His proposals target transgender youth and the medical professionals who provide gender-affirming treatments, including puberty blockers, hormone therapy, and surgeries. Now he is the president. What does that mean for Americans? Key aspects of Trump's policies. 1. Nationwide ban on gender-affirming care for minors. Trump has pledged to prohibit the use of puberty blockers, hormone therapies, and surgeries for minors across all 50 states. These interventions are widely recognized by medical organizations, including the American Academy of Pediatrics and the American Medical Association, as effective treatments for gender dysphoria in youth. 2. Defunding hospitals and penalizing schools. Trump has stated that federal funds would be withheld from hospitals that provide gender-affirming care. Schools and teachers who affirm a child's gender identity could face penalties under his administration. 3. Rewriting federal gender policies. Trump aims to pass a law defining gender strictly based on biological sex assigned at birth. He also seeks to limit legal recognition to 2 genders, male and female, and restrict participation in sports and other activities based on these definitions. 4. Investigations into gender-affirming care. His platform includes launching Department of Justice investigations into drug companies and hospitals involved in providing gender-affirming treatments. 5. Public messaging. Trump has framed his stance as protecting children from irreversible medical procedures. He has argued that these interventions are harmful and driven by radical left-wing gender ideology. His rhetoric emphasizes a binary view of gender, asserting that God created only 2 genders, and criticizing what he describes as the erosion of traditional gender roles. Broader context and reactions. 1. State-level bans. Over half of U.S. states have introduced or passed laws restricting gender-affirming care for minors, mirroring Trump's proposed policies. These laws have faced legal challenges, with some bans temporarily blocked while courts assess their constitutionality. 2. Impact on transgender youth. Studies show that access to puberty blockers and hormone therapy can significantly improve mental health outcomes for transgender youth, reducing rates of depression and suicidal ideation. 3. Conversely, restricting access has been linked to increased mental health challenges. The Trevor Project, an organization supporting LGBTQ+ youth, reported a surge in crisis hotline calls following the passage of anti-trans legislation in various states. 4. Criticism from medical and advocacy groups. Major medical associations have condemned efforts to ban gender-affirming care, arguing that these treatments are safe and evidence-based. 5. Advocacy groups warn that such policies stigmatize transgender individuals and may exacerbate mental health issues. Broader cultural and political implications. Trump's policies align with a larger conservative push to regulate gender identity and LGBTQ+ rights. The issue has become a central topic in cultural and political debates, with conservatives framing it as a matter of protecting children and traditional values, while opponents view it as an infringement on personal freedoms and healthcare rights. Now, Trump wins re-election. His proposals could lead to a significant federal shift in transgender healthcare policies, building on state-level bans already in place. This will likely intensify legal and cultural battles over LGBTQ+ rights in the U.S. Do you believe President Trump is capable implementing such a policy? Will it be considered fair? Share your thoughts and don't forget to subscribe if you haven't already.